watching TV6 News.
Mental health services are on the chopping block in eastern Iowa as their board faces a $4 million deficit.
And TV6's Haley Ryan has more on what services Iowans are in danger of losing. Haley.
The race is on to fill the funding gap because as it stands, services that could help people in crisis could be cut as soon as October.
We don't want to cut services. We don't want to end programs. They're all very important, not only to the individuals who access, but also to our families, and then more importantly, our providers who are doing the work.
Lori Elam, CEO of the Eastern Iowa Mental Health and Disability Service Region, says if the region doesn't get $4 million, they will have to cut services. Two of the programs that could be on the chopping block are the Care Coordination Service, which pairs people with mental health services, and the Co-Responder Program, which pairs mental health professionals with police to help people in crisis.
Law enforcement will be very angry, one thing, because they really have come to rely on the mental health professionals, and the people are getting services faster.
Elam says the region will have to decide what services they can start a waiting list for, but she guarantees some services will stay untouched.
Our mental health centers will not shut down. The outpatient mental health services will not go away. The inpatient hospitalization will not go away. So Genesis is not going to close, Eagle View is not going to close, Unity Point's not going to close. So the basic services are going to be fine.
She also said the region's mobile crisis and crisis hotline will still remain. Tonight, the Scott County Board will be the final county in the region to vote to support the region's letter for funds.
Haley, thank you. And after the meeting, Elam will be sending the letter to local legislators, Governor Reynolds, and the director of Iowa's Health and Human Services.